Hey, it's April 16th, and this is your COVID-19 news update. Just two things I want to note today. Justin Trudeau said that reopening the economy or easing restrictions at the US-Canada border isn't happening anytime soon and is still many weeks away. He said before that can happen, there has to be rapid COVID-19 testing and extensive contact tracing in place to prevent against a potential second wave of the virus. And outside of Canada, the head of the African Centers for Disease Control said that more than 1 million COVID-19 tests will be rolled out starting next week in countries across Africa. One projection estimates that there could be more than 10 million severe cases of the virus there over the next 6 months. Okay, on to today's episode. So we've now all heard about how older people are more vulnerable to COVID-19, how they're among the groups that are more likely to die from it. And one of the greatest fears of health experts from the beginning has been the virus hitting communities where there are high concentrations of older people, like long-term care homes, because then it becomes really difficult to contain. And unfortunately, in a lot of long-term care homes across Canada, it looks like it's already too late. Half of the COVID-19 deaths in Canada have happened in one of these homes, and the stories and images we've seen coming out of them over the last few weeks have been horrifying. Today, I want to talk about how we got here despite all the warnings. Global's Morganne Campbell and Mike Souza have both been investigating what's been happening in Canada's long-term care homes, and they're on the show today. I'm Tamara Kandaker, and you're listening to Wait, There Is More. Morganne, Mike, thanks so much for doing this.
Thanks for having us.
Absolutely, it's a pleasure.
So I want to start with a basic definition for people who don't know. A long-term care home is a place where seniors can live and get help with day-to-day activities, with everything from eating to bathing, and they're also supposed to get 24-hour nursing and personal care. So a lot of the residents at these facilities need help with their own health care. And Mike, you've been reporting on a COVID-19 outbreak at a long-term care home in Montreal. Can you describe to me what's been going on there?
Okay, so maybe first, Tamara, if I can explain the Heron Residence in Montreal. It's near the Trudeau Airport in Montreal. It's billed as a high-end facility where residents or their families are charged several $1,000s a month, sometimes up to $10,000 a month. And if you look at their marketing, they say they offer luxury, comfort, convenience, security. But what we found in recent days from looking at a bunch of documents, talking to families of residents, employees, management at the facility, and government show that there was hardly any of that luxury offered at the facility, and certainly not as the outbreak started to spread. Certainly not when people from the outside started arriving on the scene about a couple of weeks ago on the 29th of March. So this was the first time people were coming in from the outside into this building since the outbreak started, since more or less since mid-March. So you had outside nurses, doctors, volunteers coming in, and they were shocked, like there was hardly any staff who were left. They started visiting around the rooms. Some of them described like horrific odors or smells from patients lying in soiled beds for at least for hours. Extended periods of time. We don't know exactly how long, but it was clear that patient rooms had not been cleaned. The patients were dehydrated. They hadn't been fed. There was garbage and food trays on the floors. So it was horrific conditions that required a bunch of these volunteers to one by one go into rooms, try their best to clean patients in beds.
There's a smell in there, and it's a smell of the deceased and of wounds that need to be taken care of and were not taken care of for a long time.
It's hard to describe, and I can't imagine what these workers, and when they arrived on scene, how they managed to cope and deal with it. One of the nurses said that, after she left, she sat in her car for a bit and just cried. And then the next day, she decided her own mother was in a different home, and she decided to go to that home and take her mother home with her because she just wasn't, she was so disturbed and felt that people shouldn't be in these conditions anywhere. So 2 weeks later, we've just learned that there are at least 31 residents in this home who have died. And this is all being investigated by public health, by the coroner, and even the Major Crimes Unit of Montreal Police.
Crime scene investigators from the Major Crimes Unit were on site looking into possible negligence.
We're collecting documents that we're seizing, notably stuff like work schedule, list of employees.
So very dire conditions, horrific conditions based on what everyone who was on scene, what they described.
So just some additional context here before we move on, and we'll go over this stuff in more detail in just a bit. But Global spoke to Heron's co-owner, Catherine Chauieri, and she told us that Heron was struggling to contain the virus and keep its employees on the job in March because it was facing a shortage of personal protective equipment for staff, despite asking the government for help getting supplies on March 23rd. She said the companies fully cooperated with the province and wanted to help provincial authorities when they came in on March 29th and said that they were taking charge of the building. She said they've been in constant communication to help them find staff, but the Quebec government has accused Catassa, the company that owns Heron, of not cooperating and said the ongoing investigations by police, the coroner, and local public health officials will reveal more details about what happened. So, Mike, I want to talk more about how this happened, but Morganne, you spent some time in Bobcaygeon, a small town in Ontario, reporting on what's been happening at the Crest nursing home there. Can you tell us a bit about that situation?
What we know so far about Crest was that there was a respiratory outbreak on March 18th. 3 residents tested positive for COVID-19 shortly afterwards. It did not take long for that virus to tear through the home. It overwhelmed residents. It infected dozens of staff. At least 1/3 of the staff at Crest Nursing Home ended up contracting the virus. 30 residents at least passed away. We know that there were 2 other deaths related to COVID-19 and that facility. This home was at least not as publicly kind of as bad as what we're seeing in Montreal. Those stories and those reports are absolutely horrifying, but we have been told by people who volunteered there that, similar circumstances, overflowing garbages, residents that only received a couple meals a day, staff members who were completely overwhelmed and didn't have enough resources or bodies on the ground to keep things clean, to check vitals, to take care of these people. It really has been described as a war zone in those early days. They're happy to report now that there've been a number of days without any new outbreaks or any new deaths at Crest Nursing Home. So it appears that they may be, over that hump, but it was an absolutely devastating loss for the town, which is compiled of only about 3,500 people. So you can imagine that nursing home is a huge staple in that community.
So to me, what you're describing sounds pretty similar to what Mike was describing at the Montreal facility. And I know this was supposed to be a government-run facility as opposed to Heron, which is supposed to be this luxury, private, long-term care home. But were there any differences between the privately run home and the publicly run facility?
I mean, there's some differences between the private and the public homes in terms of, perhaps in terms of staffing levels, perhaps in terms of pay. But when it comes to the layout of these buildings, they are similar. They aren't made to isolate someone. There's a lot of large common areas where people interact and are close to each other. Sometimes you might have rooms where there's more than one person in a room. So it is very hard to isolate someone or keep them away from others when someone is sick and potentially contagious.
And even just to build on that, Tamara, that has been what appears to be the root of this problem across the country. A lot of these homes are quite old. Their infrastructure just does not support proper isolation. And let's not forget that these homes were busting at the seams, as it were, before a pandemic hit. So you can imagine that you have one person testing positive in a ward room. We've heard from experts that you have to be in contact with someone for at least 15 minutes to potentially pick up the virus. If you're living in a ward room, you can understand how easily that virus would be transmittable.
Right. These sound like the ideal conditions for a virus to spread. And as this has been happening, how have the families been handling it? Mike, I'll start with you.
The families, I mean, they're devastated. Obviously, it's been difficult, particularly since mid-March or so. A lot of them can't even visit these buildings because they've gone under lockdown, which makes it harder to, if you can't see the people face to face, you don't necessarily know every day how they're doing and getting regular updates. In some cases, the uncertainty has been one of the hardest things, I think, for a lot of families, regardless of where they are in the country.
And Morganne, have you had a chance to talk to family members?
Yeah, so I had the opportunity to interview a number of families at Pinecrest, and I have to say, it was one of the most heartbreaking things to have to do, to speak to a family one day that's saying, we hope that, our loved one doesn't contract this virus in the home. And then, the next day, a positive test comes through. And then, a few days later, a death. I mean, these people are grieving, they're wanting answers, and they're not really receiving the answers that they want. These people essentially were dying alone. That weighs on a person. And then to compound that even further, you look at the funeral process. A lot of these individuals clearly are not receiving that full experience in a funeral process, which for a lot of people gives them closure. I mean, there was nothing more heartbreaking than being at Pinecrest Nursing Home and looking across the yard and seeing family members standing at the windows, crying, holding their hands up, trying to get a glimpse of their loved one. It was absolutely heartbreaking.
So you guys touched on some of this already, but I want to go through it in a bit more detail. How did this happen? Mike, how did so many people die at Heron? I know you've done some digging into this and you got some documents. Tell us a bit about what you found.
We saw a lot of correspondence, Tamara, that I would describe as testy between management of the company and the government. Local public health officials, they were repeatedly asking for access to all clinical files, for keys to every room in the building. So there seemed to be a lot of dispute about who was in charge and who was getting access. We don't know why things were deteriorating to that point, but there was, I guess, a bit of a power struggle going on for several days. And at that point, there were dozens of patients who were dying and who were in dire situation. Certainly the virus had taken hold in the home at that time. The communication with the families was difficult and not necessarily transparent. Like, families weren't being contacted.
For the last 4 or 5 days, just not only not being able to get in touch with my grandfather, but not being able to get anybody on the phone. And then the next call you get is that he's gone.
The local public health officials were saying it was because they weren't getting access to the files and to the phone numbers and contact information. On the day of the day that public health officials came in, like, we could see that the company had sent an email to the families at the end of the evening on that night saying that staff had full protective equipment, that they were checking on residents regularly. But what they didn't tell the families that day was that, this urgent back and forth messages with the public health officials asking desperately for equipment and for reinforcements and workers. They didn't mention how short they were of staff and the fact that it actually required the public health officials to send their own reinforcements to help out.
But also just On how the virus spread inside the home, I read that there were people working at the home who had symptoms and that's what brought health authorities to the facility in the first place.
There was the complaint that there were people on staff working with symptoms. In particular, paramedics saw that there was a nurse on the scene that was treating patients and had symptoms. And obviously, this wasn't a good situation. The protective equipment wasn't adequate. There were serious challenges. And then by the end of that day on the Friday, a number of the staff just decided to leave either because they had been exposed and they were ordered into self-isolation, or some of them were scared and didn't want to continue going to work without protection. And so public health officials reached out to the building early on the Sunday morning, on the morning of the 29th. There was a text message that we saw where one of the public health officials says, we heard that you had a very sick nurse that was working there. We also have heard from a local hospital that you've been sending all your patients there, and we want you to stop sending your patients there. It's not helpful. It's not following the protocol. And at that point, this triggered an exchange of messages in which the operators of the facility were saying, we are desperate here. We don't have enough staff. We need help. We need equipment. And this is what triggered the public health authority to come over and inspect and bring over reinforcements and workers to help. And of course, it was at this point that they saw how dire the situation was. And they decided by the end of that evening, we're going to place you under trusteeship. We're taking charge and we want you to cooperate.
What about you, Morgan? What were you able to find out about how the outbreak spread at Pinecrest?
What I can say about the issues there, and from speaking to experts, a lot of this had to do with potentially the ward rooms being an issue, not being able to properly isolate people, having people in such close contact. But there's also been concerns surrounding whether or not employees actually had proper training surrounding personal protective equipment, PPE, and whether or not they actually had proper access to that PPE. The administrator of Pinecrest told us just a couple of days ago that they've always had enough PPE. But after speaking to some people behind the scenes, there's a suggestion that there may not have been. I spoke to one volunteer who has asked me not to reveal her identity, but one volunteer at the home who told me she works at, she's a registered nurse, and she went in to help out and she wasn't given proper PPE. She reused goggles from someone else in the home. That there were a lot of concerns surrounding just even proper disposal of these items. You have to keep in mind that there's certain rules that go with the donning and doffing of PPE. Global News took pictures of what appeared to be either employees or volunteers outside of Pinecrest Nursing Home in the days following the spread of this virus wearing full PPE. Now, we took those pictures to an infectious disease specialist who said that, that was improper use of PPE. It's easily a way to transmit the virus. When you use PPE, you're only supposed to use it on one patient and then it's to be disposed of. If you wear that PPE outside, that virus can shed while you walk through the hallways, when you touch a door handle, when you touch another person. Keep in mind that, we've been looking into this for several weeks at this point, and we do know that the ministry did not send out directives to these individual nursing homes. We know that administration at the nursing homes, they were responsible for providing updated education to these staff members. Now, the PSW union has said that they know how to properly wear PPE, but did admit also that in only 3 weeks, there wasn't enough time to go over these regulations. So there's been a lot of questions.
And if I may add, I certainly think the responsibility here, we're not looking at workers, and we can't possibly expect the workers to have been able to fix these issues if they didn't have actually, or if they weren't being offered any equipment to protect themselves. In the case of the Heron Residence in Montreal, like one of the nurses who had symptoms told us that she wasn't given a mask, and so she had to bring her own mask from home. And, as Morganne just said, like the workers, they are supposed to dispose of masks after each interaction with a patient and not move them around. So if you can imagine a worker who only has her own personal mask that she's brought in from home and then has to go with the same mask everywhere because the employer hasn't offered them enough equipment that they can be safe, the government has failed to procure the supplies to ensure that all these residences are safe. So, certainly there's a lot of questions that administrators of these facilities have to answer about what they did to prepare. And I think there's very important questions that governments across the country need to answer about what they did to ensure that they had enough supplies to be able to fight this virus in the right way.
Just a quick note here that Pinecrest told Global in early April that it had an adequate supply of PPE and that its staff were trained on proper infection control procedures. They reiterated this on April 11th, saying, quote, "Our home has been fully stocked with PPE from day one," and that it continues to work closely with public health and the Ministry of Health to implement all ongoing and new care directives from the province. We'll be right back. This has been happening across the country. So more than a month ago, there was this deadly outbreak at the Lynn Valley Care Center in North Vancouver where 18 people have now died, and experts said that should have sounded the alarm. Now, about half of all coronavirus deaths in Canada have happened in long-term care homes. And we've talked about PPE, we've talked a bit about overcrowding, but I'm also just going to go quickly through some of the other things that advocates have been saying are to blame for what's happened at these facilities, and maybe you guys can add some context from your own reporting. So some of these factors are a lack of testing, chronic understaffing, and people working at multiple long-term care homes at once. Does that ring true to you? Morganne, I'll start with you.
I absolutely agree. I mean, those concerns have been brought up by advocacy groups across this country. Another concern surrounds hospital transfers. And Global News, we reported a story, was ministry documentation that I obtained, a directive to long-term care homes saying that basically in an effort to free up hospital beds, they were going to send some hospital patients into these long-term care homes. So the idea here was, let's pull all the Ontario long-term care homes, see which ones have beds available so we can transfer hospital patients into them. Well, the problem was they were only being screened for these symptoms. They weren't being tested for COVID-19.
To be moving people into the homes who might potentially be infected with COVID-19 into homes that don't have outbreaks, because you can't move anyone into a home with an outbreak, is incredibly dangerous.
So Global News aired a story about this, and that very same night, the medical officer of health actually issued a new directive that said that these hospital transfers needed to be properly tested, not just screened, prior to a transfer to a long-term care facility. There's a lot of different pieces to this puzzle.
Yeah, well, I would just add that certainly the one of the reasons the testing is so important, not only for patients being transferred, but also in terms of the staff. Like, we know that this virus, that people who carry it quite often might not be showing symptoms. So we could have been bringing this around, spreading it without knowing it for weeks.
Well, and I think, too, we obtained some documentation dated April 8th, and it was authored by Dr. David Williams, It was basically a directive clearing asymptomatic staff, essential staff, who work in these long-term care homes to return to work as long as they weren't exhibiting symptoms. Now, that document reads, even in part, staff who have tested positive and have symptom resolution and are deemed critical may return to work under work isolation. Now, I asked Dr. Williams about that, and, he basically pointed to critically low staffing levels. This is a way to try to get people back to work. So what they would do is they would cohort those staff, and my understanding of it would be they would be in full PPE. But I think that really paints a picture as to the dire need for more staff in long-term care facilities. And Tamara, this is not a new issue. Long-term care homes, unions have been sounding the alarm about this for years, for decades. Nobody has listened. And then all of a sudden they get hit with a pandemic and everyone's listening.
Okay, so we've talked a bit about all these factors: testing, understaffing, overcrowding, PPE. But I do want to hone in on one more thing, which is staff working at multiple long-term care homes at the same time and how that has contributed to the spread of the virus. Why is this happening in so many places? Why are these workers working in more than one home?
Well, a lot of the time, Tamara, it's simply due to the fact that they can't obtain a full-time job. So what they're doing is they're working 2 to 3 jobs in order to make one full-time job. And that is something that we're hearing across the entire country. These homes do not have as many full-time jobs. So I think a lot of that has been a huge problem in potentially the spread of the virus. Now, some provinces are doing a great job at redeploying staff. I know that here in Ontario, they enacted some new measures earlier this week that has said that, employees working within different locations can no longer do that. So they're changing the assignment of the work and basically taking collective agreements and throwing them out the window while we get through this pandemic. So, and they're also looking at different scheduling and shift assignments. And I actually spoke to a male nurse at a home in Mississauga the other day who literally moved into the home to help and not potentially transmit any cases of COVID outdoors.
Yeah, so let's talk a bit about the government's response to all of this. So Ontario's introduced that measure to stop people from working in multiple homes at once, but I know they're also putting in some other measures in place too.
Yeah, so my understanding is that they're also hoping to bring in extra part-time or temporary staff members, contractors, to help alleviate some of the stress, whether that be, somebody who can come in and take care of janitorial work. They've also been using volunteers to help out with some work, and some advocacy groups would highly advise against that. But, the Doug Ford government came out with these new orders earlier this week.
And over the next 48 hours, we will be launching more aggressive testing, screening, and surveillance by screening all symptomatic staff and residents, as well as asymptomatic contacts of confirmed cases.
But there's been no secret, and Mike, maybe you can talk a little bit about this, but there are other provinces that appear to be doing this much better. We seem to be deregulating the system when other provinces are putting more regulations in place.
Mm-hmm. Mike, do you want to add to that? What's the Quebec government doing about all of this?
One of the things in the past week that Quebec has done, particularly after the Heron shocking details and horrific details there came to light, is they said that they were suddenly going to start doing or stepping up inspections of the private facilities. There's about 40 private facilities, long-term care facilities in Quebec. It's kind of surprising, though, that this hadn't been done earlier, but they made a pointed effort over the weekend to start visiting each of those long-term care residents to see exactly what was going on. So perhaps it was a blind spot where they weren't keeping enough of an eye on the procedures and the operations going on there. They found 4 or 5 that were suddenly listed as being of serious concern, where there could be issues that were similar to what was going on at the Heron facility that they hadn't previously seen. So I think the stepping up of inspections issue is one of the key things that Quebec has been doing differently, really to keep track of it. And overall, I think it's clear that there is full-time work needs at each facility for any of these workers. It would be really up to the administrator of these facilities to give them the full-time work. And right now, I guess under the current regulatory system, pretty much everywhere, those rules are not in place that require them, if they want to hire someone on a casual basis, to give them more work. And perhaps that's where we could be headed in other provinces. I think BC might have been ahead of others in terms of stopping the back and forth work, but this is probably going to become more of a rule rather than an exception, I think.
Okay, thank you both so much.
Thanks for having us, Tamara.
Absolutely. Thanks for having us.
So just one more note on how Quebec is responding to the crisis in its long-term care homes. Premier Francois Legault has called on doctors to help in the homes, and so far, more than 2,000 doctors have signed up. He's also asked the federal government for help, and today, Justin Trudeau said that the two governments are working on a response that could involve the Red Cross, volunteers, and the military. You can find all of Morganne and Mike's coverage on this issue at globalnews.ca. I'm Tamara Kandaker, and I'll talk to you tomorrow.